Now, another cutting-edge area, fertility preservation in children. There are peculiarities about approaching the children. Obviously, if they're prepubertal, again, we cannot stimulate their ovaries. Our only option is gonadal tissue freezing. And later on, we could transplant it, or there is a future possibility of extracting these follicles and growing them in vitro. This is not really successful in humans yet. Now, we have also had occasions, parents froze their eggs. Mother freezes her eggs for future use of her child. And again, open the discussion about same genetic pool. And in postpubertal, if they're old enough, we do oocyte freezing and we'll discuss it. And the boys, it's the same thing. Prepubertal tissue freezing, testicular tissue freezing. These will either be transplanted in the future or extract spermatogonial stem cells and inject them back in the tubules. They will recolonize. And that's the idea, again, based on animal studies. Very experimental, very, very experimental. In the postpubertal autologous sperm freezing, there are ways to obtain sperm from shy adolescent children. Okay, so fertility preserving children. I'm not going to go into cancer, but Turner's is something you may see in your practice. I want to study this case with you. A 14-year-old girl was referred to me. The way she was diagnosed with Turner's was that she had fractures at age 13. You have osteoporosis or Turner's. So that turned into a workup and turned out that she had mosaic Turner's. So this girl had menarche at age 11 and had irregular periods after that. So she was referred to me for fertility preservation evaluation. But let's look at whether it's realistic to look at Turner's girls as a potential future mother. Pregnancy is possible in 3 to 5% of Turner's. And mostly in mosaics, or those who have very distal small arm deletions, or where there's a special locus that's preserved that more relates to ovarian function. Around 50% of mosaics will enter puberty. 5 to 10% will have regular menses, so you wouldn't even catch these girls. A lot of times you catch them by slow growth, and you wouldn't suspect. They have the highest pregnancy loss rates. Even donor egg pregnancy loss rate is high. They have a lot of medical issues: thyroid, they got aortic coarctation, they have your genital, urinary tract abnormalities. So only about 38 to 40% will have complication-free pregnancy, but they do have children in the end, and these girls are potential candidates for future fertility. So what happens in Turner's with their egg reserve? They're actually born with about normal reserve of eggs, but they lose them at a very fast pace. So by the time they reach puberty, all eggs are gone. So you have to catch them as early as possible. So for ovarian stimulation, obviously we can't do this before they're about 14 or so. Some undergo ovarian freezing before then. But in this girl, what we did was we looked at her ovarian reserve assessment. Now the classic ovarian reserve assessment is on day 2 or 3. You measure their FSH and estradiol. And if this is elevated, that indicates diminished reserve. And paradoxically, if estradiol is elevated, that indicates diminished reserve as well. Because when FSH goes up, it stimulates ovary to produce estrogen. So you're seeing that her estrogen is already high, and that indicates diminished reserve. Her AMH is 0.9. To give you an idea, anything below 1.1 or 2 is low. And this is comparable to somebody who's in her early 40s. So you've got a 14-year-old with an ovarian reserve of 40 plus. Another way of measuring ovarian reserve is an anterior follicle index. So you look at ovaries, you count small follicles, and these two correlate well. This is 12. In an adult, if it's less than 6, we call it low. But a 14-year-old 12 is low. So now that she had some reserve, when we discussed ovarian and oocyte cryopreservation, and these are very educated parents, very motivated, mature child, they decided to go with oocyte freezing. We did ovarian stimulation with this girl. We cryopreserved 11 oocytes. Next year, in the next summer break, school break, she came back and stimulated her again. This time we had 6 eggs, but 1 was immature, 1 was abnormal. So now this time we got 5 eggs. So in 1 year, she went down from 11 to 5. It already progressed. So bottom line is in Turner's, it is possible, especially if they're mosaic.